what will we perform general physical examination. This may be a talk station in undergraduate exam as well as in postgraduate examination. So here is a patient from which we have taken consent and exposed, and we have taken consent for making videos. We start performing general physical examination. General physical examination starts with examination of hands. So we can see a scar mark here. There is no other scar, no pigmentation, deep hyperpigmentation or depigmentation. And on the other side of the palmar surface of the hand, सीधे करें बेटे हाथ. So there is no palmar erythema, no deformity, no contracture. I can feel callosities at these spots. So हाथ सीधे करें ऐसे. So there is no palmar crease, jaundice or pallor. There is a scar, there is a mark here. These are callosities. This is a mark. This is a callosity, and rest of examination is okay. Now the examination of nails. So nails can have clubbing and chylonychia. For chylonychia, you have to go at the level of the nails, and nails appear as spoon shaped. For clubbing, you have to so by doing this maneuver, we can elicit clubbing of the nails. Then, after examination of hand, we examine the pulse of the patient. And with the patient, hold the patient, reassure the patient. You can feel palmar sweating and warmth of the palm. And besides that, you can examine pulse for 1 minute. So in the same 1 minute, you can examine temperature of the patients. In the meantime, you count pulse for 1 minute. You calculated the rate of the pulse and rhythm and volume of the pulse. And now I will compare it with opposite side. So if there is radial delay or anything. So it has taken 1 minute, and in 1 minute we can see temperature of the patient. So after taking pulse and temperature of the patient, now we are going to check blood pressure of the patient. So blood pressure is 120/80. In the vital signs, pulse, temperature, blood pressure. And scheme is that we will go up straight to the scalp of the patient, and we will examine the scalp for seborrheic dermatitis, for infected sebaceous cyst or sebaceous cyst, because these findings eventually enlarge cervical lymph nodes. After examination of scalp, we have to examine eyes of the patient, and in eyes we examine pallor. Pallor is seen on palpebral conjunctiva, right? And then नीचे देखें. The other thing we have to see is jaundice, and for jaundice you always mention or take the patient towards bright daylight. नीचे देखें पाँव की तरफ. We can see in this case is corneal opacity in left eye, whereas right eye is okay. Then we move to the nose. Nares, both nostrils separately, checking for deviated nasal septum, growth or turbinate hypertrophy. Then we come down and examine the mouth. So here you can see a growth on tongue. That may be a papilloma. I have a wooden speculum and I will explain that this is clean. बेटे ये साफ ज़ुबान के मुआयने के लिए टुकड़ा है. इससे मैं आपका ज़ुबान का मुआयना करूँगा. ठीक है? मुंह खोले ज़रा पूरा. शाबाश. So you can see uvula and posterior pharyngeal wall, gums and vest, मुंह खोले, पूरा मुंह खोले, and पूरा मुंह खोले, and vestibule. Then is the examination of external ear. Pinna, any deformity, then external auditory meatus and post-auricular groove, bilateral. Examination is lymph node survey. We position the patient and you go on the back of the patient and start palpating submental lymph nodes, and you examine the lymph nodes with number of fingers according to the space available for examining those lymph nodes. As submental space is low, so you can use only 2 fingers and make rolling movements to see any nodule here. Here in submandibular region, as the space is a little larger, so you can use 2 fingers and examine submandibular lymph nodes by 2 fingers. Then is anterior cervical chain. Anterior cervical chain anterior to the border of sternocleidomastoid. On the other side, anterior cervical chain on the opposite side. Then posterior cervical chain on posterior border of sternocleidomastoid. Okay, right? Then preauricular lymph nodes like this, making rolling movements like this. Then post-auricular lymph nodes, and then occipital. By shrugging the shoulders, we can easily palpate supraclavicular lymph nodes. For left axilla, you place left hand of the patient on your left shoulder. 5 groups of axillary lymph nodes: anterior, posterior, lateral, central, apical. So anterior group of lymph nodes is felt against the pectoralis major muscle here. And how is felt? हाथ इधर रख दें बेटे और बाजू बिल्कुल ढीला छोड़ दें. Like you place your tips of your finger behind pectoralis major muscle, hold pectoralis major muscle like this and make rolling movements. So you are examining left axilla of the patient with right hand. In left axilla, the lymph nodes you can examine are anterior group and central group, right? With right hand. So this is anterior group. Then you make direction of your fingers like this and check for in the depth of axilla, check for central lymph nodes. For lateral group of lymph nodes, you hold the elbow of the patient like this, lift the hand from here and palpate the lateral group of lymph node with your left hand against the head of humerus, against the upper part of humerus. The apical lymph nodes are embedded deep in the fat and they can't be palpated. Now only one group is left, and that is posterior group. For posterior group, you have to go on the back of the patient. Posterior group lies in front of fold latissimus dorsi muscle. Make the patient comfortable. Hold the fold of latissimus dorsi and feel for axillary lymph nodes. Next thing in lymph node survey is examination of inguinal lymph nodes. The most lateral bony point is anterior spheric iliac spine, this one, and the most central point is the pubic symphysis. Draw an imaginary line, and mid of this imaginary line is mid-inguinal point. This is the point where femoral vessels pass down into the legs. So the inguinal lymph nodes are located along femoral vessel. So always lymphatics and lymph nodes accompany arteries. So the vertical group of inguinal lymph nodes will be here, whereas Transverse group of lymph nodes is along the inguinal ligament. Make rolling movements and feel for inguinal lymph nodes like this. And then the vertical group. And the last thing in general physical examination is ankle edema or pedal edema. And where is it checked? Against the hollow, against the bony surface, medially a few centimeters above the medial malleolus. You press for 10 seconds, look for any depression. You do it on the other side as well. This is medial malleolus. A few centimeters above is the medial subcutaneous surface of tibia. You press here for 10 seconds. You lift the thumb and see for any depression for pitting edema. Thank you very much. Thank you. So this is the general physical examination.